Hepatocellular carcinoma. Definition. Hepatocellular carcinoma is a cancer that starts in your liver. It's different from secondary liver cancers, which have spread to the liver from other organs. If caught early, it can sometimes be cured by surgery or transplant. In more advanced cases, it can be cured by treatment or support can help you live longer and better.
As opposed to benign hepatic tumors, malignant hepatic tumors are cancerous, very severe, and are actually now the third leading cause of cancer deaths worldwide. With these malignant liver cells, or hepatocytes, just like malignant cells in other cancers, they develop some mutation that causes them to replicate at way higher rates. Watch the full video on osmosis.org.
Hepatocellular carcinoma is a cancer. Epidemiology. The United States, liver cancer is the most rapidly increasing cancer in both men and women, with incidence rates more than tripling since 1980 from 2006 to 2015. The rate increased by about 3% per year. For 2020, the American Cancer Society estimates that 42,810 new cases of liver cancer, including intrahepatic bile duct cancers, will be diagnosed. Approximately 3/4 of these will be HCC. Hepatocellular carcinoma is a hepatocellular carcinoma. Applications in medicine. Hepatocellular carcinoma is a primary malignancy of the liver that occurs predominantly in patients with underlying chronic liver disease and cirrhosis. However, up to 25% of patients have no history of the cirrhosis or risk factor for it. Etiology: cirrhosis, metabolic factors, alcohol, hepatitis B, virus infection, hepatitis C, virus infection, hemochromatosis.
Hepatocellular carcinoma. Chronic hepatitis B is the most common cause worldwide. Chronic hepatitis C is the most common cause in Europe. The main risk factor for developing hepatocellular carcinoma is liver cirrhosis, for example, secondary to hepatitis B and C, alcohol, hemochromatosis, and primary biliary cholangitis. Features: tends to present late. Features of liver cirrhosis or failure may be seen: jaundice, ascites, right upper quadrant pain, hepatomegaly, pruritus, splenomegaly. Possible presentation is decompensation in a patient with chronic liver disease. Screening with ultrasound, with or without alpha-fetoprotein, should be considered for high-risk groups such as patients with liver cirrhosis, secondary to hepatitis B and C, or hemochromatosis. Men with liver cirrhosis secondary to alcohol.
Applications in medicine. Diagnosis. The diagnosis of HCC can often be established off the basis of non-invasive imaging. Without biopsy confirmation, even when biopsy is needed, imaging is usually required to diagnose. Laboratory evaluation of patients with newly diagnosed HCC should include testing to determine the severity of the underlying liver disease and the elucidates the etiology of the underlying disease, such as the following.
This video is intended to provide introductory information on this topic to the general public. It is not intended as a substitute for professional medical advice. Always rely only on your own doctor in matters related to your health. Before spelling out the details of liver cancer stages and substages, it helps to understand the criteria for judging what a liver cancer stage is. A stage is simply a way of describing how far cancer has progressed and what form that progress has taken. It's important to remember, however, judging a liver cancer stage is more complicated than judging stages for other types of cancer because liver cancer patients may also have liver damage. This fact makes a difference in determining the prognosis and treatment possibilities. The lower the stage, the more likely it is treatment will lead to a positive outcome. The judgment of a stage depends on the size of a tumor, the location, is the cancer present in just one lobe or both, the spread or extent of the cancerous cells. The third criteria is divided into two parts. Has the cancer grown into or around blood vessels? Has the cancer spread into adjacent lymph nodes or organs? Using these criteria to judge the stage of liver cancer, medical professionals and researchers have come up with the following groupings. Stage 1. The tumor measures 2 centimeters or less, occupies a single area, and can be removed surgically. Stage 2. Cancer occupies one or more locations but hasn't spread to nearby blood vessels or lymph nodes. When this is the case, doctors divide stage 2 into two more possibilities. There's a single tumor 2 centimeters or more present, or there are several tumors, all less than 2 centimeters in diameter, and the cancer is present in only one lobe of the liver. Stage 3. Liver cancer at this stage is considered to be advanced and is divided into several substages. Stage 3A. The cancer has not spread to other organs or lymph nodes. This stage is further broken down in two ways. There's one tumor, larger than 2 centimeters, and nearby blood vessels have been affected. There are several tumors 2 stages or larger, and nearby blood vessels have been affected. Stage 3B. Tumors can be of any size, and cancer cells have spread to adjacent lymph nodes without affecting other organs. Nearby blood vessels may or may not be affected. Stage 4. At this stage, liver cancer is judged to be disseminated or diffused, meaning one or more of the following. The cancer has spread to more than one lobe of the liver. The cancer has spread to other parts of the body. Tumors can be any size or number. Blood vessels are affected, and nearby lymph nodes may or may not be involved.
Diagnosis. Treatments. Management of the Hepatocellular Carcinoma, HCC, is best performed in a multidisciplinary settings. Patients should be comparatively managed by hepatologists, transplant and hepatobiliary surgeons, medical oncologists, interventional radiologists, and palliative care specialists.
Hepatocellular carcinoma is a primary cancer of the liver. It's a cancer that develops primarily in patients who have liver cirrhosis. It's the third most common cancer in the world and one of the leading causes of cancer deaths. The reason it develops is because when patients become cirrhotic, their livers become nodular and inflamed, and tumors develop in these inflamed nodules. The major cause for hepatocellular carcinoma has been hepatitis C, which has been one of the leading causes of cirrhosis. But more recently, we're seeing increasing numbers of patients with hepatocellular carcinoma who have fatty liver disease and have fibrosis, not just cirrhosis. So any inflammation in the liver can cause these tumors to develop. For most patients with hepatocellular carcinoma that present to our center, we evaluate them for liver transplant if they come in in the setting of cirrhosis. The other option is surgical resection or cutting the tumor out. And for those patients who are not suitable for transplant for one reason or the other, they may be suitable for a resection. Not everybody is suitable for resection, and it depends how bad the liver disease is, clearly. And the third modality is treatment from the interventional radiologist with either wires that go into the tumor and burn them from the inside with chemotherapy, or burn them from the outside through wires that come into the liver from the outside. All of these can be combined to get the best results for the patients. The advantage we have at at New York Presbyterian for treating such a challenging disease is that the surgeons here are capable of resecting and transplanting the livers. We have experts in interventional radiology at treating these tumors. When you have a multidisciplinary team that's composed of surgeons who do research on the disease, who can cut the liver out or can transplant the liver, as well as hepatologists who are invested in researching the disease, and oncologists and radiologists, you get a better result for the patient overall. And the patient is
Pro and cons. Various studies have reported extrahepatic metastasis is up to 30–50% of cases of HCC, with lungs the commonest site, followed by lymph nodes and bones. Usually extrahepatic metastasis sites include brain or skin. Complications. Complications from HCC are those of hepatic failure. Death occurs from cachexia, varicose bleeding, or rarely tumor rupture of bleeding in the peritoneum. Signs of symptoms of hepatic failure might signify tumor recurrence or progress.
HCC is called the silent killer. The impact is really not the patient himself. All the families are affected.
Because 在中国呢，有100万人是乙肝病毒携带者。
Hepatitis B carrier status and hepatitis C carrier status are really the predominant risk factors of HCC, which cause inflammation and cirrhosis. With the advent of hepatitis B vaccination programs in childhood, we expect that to drop, and it has already in many Asian countries. Today, the world has changed phenomenally. The new risk factor that's a concern to everybody is fatty liver, and a lot of that can be attributed to a modern urban diet.
Now we have very high prevalence of the obesity and diabetes. We have to put more attention about this. I saw a patient, he was diagnosed at a late stage of liver cancer. He even cannot walk. So he has to rely on his wife to take care of all the daily activities. Family members and patients, they want to have more treatment options. So it is very important to help the patient access to more effective treatment to improve their survival rate and get a better quality of life.
Issue applied in Ecuador. Cirrhosis is not the only pathway pathological from the development of HCC. Since the cirrhotic with metabolic factors such as diabetes and obesity represent a higher risk factor, important because in Ecuador many populations have diabetes. Conclusions. Overall prognosis for survivor is poor, with at 5 years relative survival rate of 18%. By stage of the relative 5 years survival is 32% in patient diagnosis with localized disease, 10% with regional disease, and 2% without distant disease. Length of the survival depends largely on the extent of cirrhosis in the liver. Cirrhotic patients have shorter survival time and more limited therapeutic options. Portal vein occlusions, which occur commonly, for terms and ever shorter survival.